Welcome to the Friday Five here on the Agent Survival Guide podcast. I'm your host, Sarah Ruppel, and this is our weekly recap where we bring you top headlines and trending industry news. Before we get into our list, happy Friday to you and happy AEP as well. This is the time we've been preparing for all year long. AEP 2024 is finally here, and we know you're busy, so let's get right into this week's list. Number 1, CMS has been busy releasing all sorts of reports and numbers, most of them essential to the work that we are doing this time of year. A lot of that information came down to the wire this year. We've been trying to post information as we get it, and that has resulted in some out of the norm publishing days and times. So apologies for that. On Thursday last week, the September 2023 CPI report was released. And on the heels of that information, we got our cost of living adjustment for 2024 from the Social Security Administration. This year's COLA came in at 3.2%, definitely lower than last year's historic increase. We knew that the adjustment for 2024 was likely going to be lower, and it came in right around expectation. That adjustment will translate to an increase of about $59 in the Social Security checks of beneficiaries. Great to have that information for your clients as you're meeting with them this AEP. And we will have the links to our episode on the COLA announcement, as well as some resources that you can share with your clients about it. Number 2, speaking of sharing, we've got more numbers that both you and your Medicare clients want to know. The Part A and B premiums and deductibles for Medicare coverage in 2024. We'll start out with the Medicare Part B costs, which will both increase for the coverage year 2024. The monthly Medicare Part B premium comes in at $174.70 for 2024. The annual deductible for Medicare Part B is $240 for 2024. On the Part A side, premiums depend on how many quarters of Medicare-covered employment a beneficiary has put in. 99% of beneficiaries receive Part A premium-free because they've worked at least 40 quarters for Medicare-covered employment. If you've got a beneficiary who has worked for less than 30 quarters of Medicare-covered employment, they will pay a Part A premium of $505 per month in 2024. Beneficiaries who have paid Medicare taxes for 30 to 39 quarters will pay a Part A premium of $270 per month. And then the Medicare Part A inpatient hospital deductible comes in at $1,632 in coverage year 2024. If you missed our episode on the Medicare Part A and B premiums and deductibles, we detail a few other benefit cost amounts, like the Part B ID benefit and the daily coinsurance amounts, just to name a few. We'll be linking to that episode in our notes, as well as the text version on our blog. The blog post provides some additional comparisons and tables, so really up to you how you like to consume your information. We try to create it in a few different formats for everyone. Number 3, also announced from CMS last week, some important numbers for Medicare supplement plans in 2024. We've got deductibles and out-of-pocket limits. We'll start with the deductibles. So historically, Medicare supplement plans F, G, and J have all had a high deductible option. Plan J was a MedSup option that was discontinued to new enrollees in June 2010. That was phased out with the Medicare Prescription Drug Improvement and Modernization Act of 2003 due to advancements in the Part D product. Those who were enrolled at the time could remain enrolled in the plan, so there are still people who have that coverage. MedSup Plan F was another high-deductible option that was retired for new enrollees beginning January 1st, 2020. That was phased out by MACRA, or the Medicare Access and Chip Reauthorization Act of 2015, which eliminated first-dollar coverage in Medicare, meaning that the Part B deductible was covered by the cost of the plan. Similarly to Plan J and other discontinued MedSup plans, those enrolled in Plan F at the time were able to remain enrolled in the plan. This change was more recent than the Plan J discontinuation, so it's more likely that you've seen clients who still hold this type of MedSup plan. Plan G also has a high deductible option, and it's currently the most comprehensive Medicare supplement plan coverage available. It covers everything Plan F covered, minus coverage of the Part B deductible. Even though 2 of these plans have been semi-retired, the deductible amounts for all 3 each year are set at the same amount. This annual deductible is a threshold beneficiaries must meet before their MedSup plan will pay for their benefits. For 2024, the high deductible for MedSup plans F, G, and J is $2,800. Now, let's move on to out-of-pocket limits. Medicare supplement plans K and L feature cost sharing, out-of-pocket limits, and lower monthly premiums to distribute costs a little differently than other MedSup plans. The out-of-pocket limit changes yearly, and this amount, plus the Part B deductible, is what beneficiaries will pay before the plan pays 100% for approved services. Both of these numbers increased for 2024, with the Plan K out-of-pocket limit coming in at $7,060. The out-of-pocket limit for Plan L is half that amount, at $3,530. We will be linking to an updated MedSup benefit table in our notes, as well as the official release from CMS. Number 4, and if you guessed that this was another CMS release, you would be correct. On Friday last week, CMS released the star ratings for 2024 Medicare Advantage and Part D plans. According to the report, about 42% of MAPD plans offered for coverage year 2024 have an overall star rating of 4 stars or higher, and that is out of 5 possible stars. 42% factors out to 229 contracts out of a total 545 contracts. And then weighted by current enrollment numbers, which we know will shift a bit as AEP progresses, CMS reported about 74% of MAPD enrollees are currently enrolled in plans with 4 or more stars for the 2024 coverage year. Just 31 Medicare Advantage contracts are rated as 5-star plans for the 2024 coverage year, and 6.9% of MAPD beneficiaries are enrolled in one of those 5-star plans. For more information on Medicare Advantage and Part D plan star ratings, we will be linking to the CMS release as well as a few other resources in the notes. If you have star ratings references in your sales materials, definitely want to update those with the latest stats to stay compliant. Number 5. A few weeks ago, while live streaming with Israel's Prime Minister Benjamin Netanyahu, Elon Musk mentioned that a subscription fee could be coming to X for all users. Specifically, quote, moving to have a small monthly payment for use of the X system, end quote. He also mentioned that this was a step he saw necessary to fight the ongoing bot problem on the platform. On Tuesday this week, Musk gave more details about the subscription fee, touting it as part of their Not a Bot program. X plans to roll out the program to a very specific group of users, new web users in New Zealand and the Philippines. First, the new users will be required to verify their phone number. And second, they'll be charged an annual $1 subscription fee in order to use the site. That payment will turn on certain functions like the ability to post, like, reply, repost, quote, and bookmark posts. Basically everything a non-Twitter Blue user can currently do. Without that annual subscription, new web users in those regions will still be able to access the site, but in essentially read-only mode. They'll be able to view content, but they won't be able to post anything of their own. For now, X is testing the program, as I said, in the Philippines and New Zealand. No word on when a similar requirement might come to the US. Now, will this work out for Elon and his fight against the bots on X? I would say that the jury is still out. We will continue to keep an eye on the happenings over on X and report back with updates. But that's all we've got for this week. I hope you have a great weekend. Stay healthy and stay safe out there. And we will see you next week. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written and produced by me, Sarah Ruppel. Script editing and fact check by Tina Lamoureux. Podcast design by Urban Rivera. Artwork by Vivian Zhao. Follow along with us wherever you like to listen.